Okay, now this is our third video of the series, and we're going to talk about, so what is the most common symptom patients come to you for when you suspect they have long COVID?
So the most common symptom I've seen in patients is they complain of fatigue. They say, I'm very tired. I feel my entire body is paining. I don't have energy to do my daily activities. So this is the most common symptom that they have is fatigue. Of course, there's another symptom that goes along with the fatigue. They feel very tired after the exercise. They have no exercise tolerance. So they're like, after I take a step, I feel breathless. I take 3 steps, I feel even more breathless. I can't do my daily activities. So there's kind of an overlap between the exercise intolerance and the fatigue. But if you just want to call it one word, it's just fatigue.
And I'll pause you right there. And do you know that as a medical doctor, what is the symptom that we are most afraid of hearing?
Yeah, what is
Fatigue.
it?
Because there's
Fatigue,
so
yeah.
many causes for it. Even if you don't have long COVID, so many different causes. So working through that is tricky. So how do you work through? Tell me your thought process when a patient says, "Okay, doc, I'm tired all the time." So what's the first thing that comes to mind for you?
So what I would usually ask them is, firstly, I want to know if this fatigue has been caused because of COVID. So I ask them, well, did you have fatigue before you got COVID? So if they say, no, I didn't have fatigue before I had COVID, then I know it is somehow connected to COVID. Then my next question would be, did this fatigue start after taking vaccination? Then if they say yes, the fatigue started after vaccination and got worse after I got COVID, then I know that it's connected somehow to COVID as well as the vaccination. If they say, well, no, it didn't have anything to do with the vaccination, I just got it after I recovered from COVID and it's continuing, that means, okay, this is definitely because of COVID. Then the next aspect I would know is, what kind of treatment did you take for COVID? So say the patient took some steroids, say he took a whole bunch of dexamethasone or methylprednisolone. The major culprit here would be dexamethasone, because if they've taken dexamethasone and they haven't tapered it, their own blood cortisol could have gone down. Now, one way you can check this is you can actually run your blood cortisol levels. You can check your morning and your afternoon and your evening cortisol. Either you do a blood test or you can even do it through your saliva. If those values are low, that means yes, you're having fatigue because your cortisol is low. The way to fix this is either you can take herbs like ashwagandha, or you can take some allopathics, like you can take low doses of hydrocortisone to pump your level of cortisol high. Or you can even take these low dose homeopathics. So the most common low dose homeopathic that I use for low cortisol is I give the patients a mixture of a homeopathic called as pulsatilla. It helps to increase ACTH. ACTH is your hormone which is released from your pituitary, and that actually goes and tells the adrenal gland to make more cortisol. So in most of our patients of COVID, we have seen that the ACTH levels are very low. In many of these cases, even if they haven't taken steroids, we find that the ACTH is low. So we do give them pulsatilla if ACTH is low, and we do find the cortisol going up if this is the case. One of the symptoms you could have if your ACTH is low is you could be actually having a lack of appetite, because the ACTH triggers appetite increase. If your appetite has all of a sudden fallen after you've got COVID, you may be having low ACTH. If your ACTH is low, another symptom that you could be having is you will all of a sudden become very weepy. You will tend to have crying bouts. That's not your personality, but it was never, you were never like that before, but now you will start having these as symptoms, sudden bouts of crying. These are again symptoms that your ACTH is low. And if this is there, you can actually run your test and you can find out if it's low and then take pulsatilla to fix it.
I'm
If
gonna
the
pause
problem,
you there,
yeah.
and I was quite curious if there wasn't any steroids taken, to treat your COVID. You got a really mild. So before that, if you have a very mild case of COVID, could you still develop long COVID symptoms?
Yeah, you can. So the fact is that your COVID may not be severe for you to get long COVID. It could just be mild. Many people actually suffer from adrenal fatigue. Almost around 30% of the population has adrenal fatigue because of chronic stress.
Mm,
So they usually suffer from symptoms like low blood pressure, they get postural hypotension, they wake up in the morning and they feel giddy, or they are sitting down and they
mm.
stand up and they feel giddy. So these are some of the symptoms that they naturally have. Their blood sugars
Okay.
are usually
I
down.
think I get it because it's then COVID is the straw that broke the camel's back,
Yes,
basically.
it's a straw that has broken the camel's back.
So, what other remedies do we use around cortisol?
Yes. So if say if your ACTH is normal and you don't have this lack of appetite as an issue, then the other thing is that your adrenal gland may not be responding to the ACTH coming in. So if you run your ACTH and you see your ACTH is high and your cortisol is low, your adrenal gland is not responding. When you run your white blood cell counts, because your cortisol is low, your total white blood cell count will be low. So you'll find that instead of having a count of around 4,500, your count will be 3,800, maybe 4,000, maybe 4,300, or right at the border of around 4,500.
Yeah,
This
that was
also
that
means,
was really what happened with my husband. His
yes,
white count was so low, he was actually neutropenic for months.
yes, you
And he's
become
a
neutropenic.
frontliner. He's a frontliner. So I was really concerned because if your immune system is down, and I didn't even think that it was long COVID at that time because this was really early days during the pandemic and we didn't we haven't started the conversation around long COVID yet.
True. So
Yeah.
if you're neutropenic, as Dr. Tay said, the remedy that fits you is NACMER. NACMER is a homeopathic which is made from basically salt and water, and the job of cortisol is to regulate salt and water in your body by regulating the excretion of sodium and also by regulating aldosterone, which is the hormone that ultimately does it. So
Mm.
if your total white blood cell count is low after COVID and you're suffering from long COVID, you simply have to take NATMER and that will fix your issue out.
Mm.
Within a few days of taking NATMER, your energy levels will start coming back up. The third
Mm.
medicine that we found is we actually use a homeopathic called as adrenaline, which is made
Mm.
from the adrenal gland. It's so you can use adrenaline 6x or 3x. It's a raw extract of the adrenal gland, and when you take that in, you'll find that your blood pressure starts going up. So if you have fatigue with low blood pressure, then you will need to add adrenaline along with it. But if your blood pressure is high, then do not take adrenaline, okay, because it
Cool.
will just make your blood pressure go higher.
I
So
see.
this is just around cortisol. So if I would put it in a nutshell, because I've spoken a lot, if you are having lack of appetite, okay, and you're getting sudden bouts of crying, and you test to see your ACTH and you see your ACTH is low, use pulsatilla. If you find that your total white blood cell count is low, your cortisol is low, your ACTH is high rather than being low, you can take NATMER and that will fix your fatigue as well as fix your white blood cell count. And if you always had adrenal fatigue and your blood pressure has always been low, you may require pulsatilla for fixing your ACTH. You may require NATMER for fixing your cortisol, and you may require adrenaline to purposely fix your adrenal gland and actually make your adrenal gland function better. So these are the three remedies that you can move around. Amongst the herbs, you can take herbs like ashwagandha, which help you because they are adaptogens and help you adapt to stress better.
Very nice.
That's about fatigue. Now, this is only one cause of fatigue. Okay. The other cause of fatigue that we found is patients suffer from fungal infections after COVID. How do you understand if you have a fungal infection? The classical thing that people understand, oh, I have a ringworm infection around my skin is itching. That's only skin fungal infection. That means you have candida on your skin. But not all patients will have candida on their skin. Some patients have candida which is affecting their internal body. And one of the ways that we do is we tell patients, please stick your tongue out for me. When they stick the tongue out, we look if their tongue is coated white. If they have a white coating on their tongue, that means they have a fungal infection in their body which is causing them fatigue. There was a case of a whole family, okay, who had come to one of the doctors in the group. They had COVID, and during COVID, they were taking a lot of zinc supplementation, lots of zinc. They were taking up to 50 mg, 100 mg, at times taking it 2-3 times in a day because they were told that zinc helps to improve your immune system. Now,
That was
zinc
what I was
also,
told.
yes. So zinc, when in high doses, triggers the growth of fungal infections. And these patients had developed severe fungal infection and they were having severe fatigue. So they kept telling the doctor, I have severe fatigue, I have severe fatigue. And she kept calling me up and asking me about fatigue. So in the end, I told her, what medicines are these patients taking? What are they doing? She says, oh, I never asked them. I said, ask them. And all of them said the same thing, they're taking high doses of zinc. So we stopped the zinc and we gave them a few of my antifungal medications. I have an antifungal combo, which is basically made from a herb called as nyctanthus. It's made from the seed of it, and it targets candida when it's happening internally in your body. So we gave them med to them, and within a few hours, the husband, who was very fatigued, couldn't get up and walk, started to be able to get up and walk. He went for a bath, and after actually more than a week, he was able to have a bath for the first time. And then his wife saw him having a bath. She says, well, I need to take the med myself. Then she took it, she got better. The daughter took it, she got better. And the only cause was because
Nice.
they had so much of zinc in their bodies. It was a zinc overload situation.
Oh, I see, I
Zinc
see.
in high doses can also worsen dementia. So that's one more thing that patients suffer from. They have, after COVID, they have lack of memory. So they say, I'm very tired and I feel I can't remember things. It could simply be that you have a fungal infection along with dementia being caused by the overload of zinc that you're on.
Wow.
So for such cases, we just treat the fungal infection and we stop them from taking in zinc, and they do much, much better. So that's the
So this
second
is
cause of fatigue.
our first commonly used supplement,
Yes.
and that can cause problems. So take note. There will be a lot of these little nuggets along the way, and we're not saying you can't take any of these supplements, but
Yes.
watch out for these symptoms, and be informed about this phenomena. Oh, do you know, for an average person, how much zinc is too much?
That's a difficult question to answer, so I'll explain this. So, one of the ways we use zinc is, we say, I think you're having low zinc. One way I can do this is I can ask you, hey, let's get a blood test done for zinc and see if your zinc is low. Another thing I can do is I can check if you have lack of taste. So, patients who have low zinc usually tend to have lack of taste. So, we use a taste test. It's called a taste test. We give them 1% zinc sulfate. It's just 1% of it, and it's put on the tip of the patient's tongue. Okay. And if the patient can taste it, that means they don't have low zinc. But if they get that sort of metallic taste that's coming in, that means that if they can't taste it and they don't get that metallic taste coming in, that means that the zinc levels are low. Okay. So
Cool.
this is how we can actually do a zinc taste test to see if your zinc is low. Also, zinc
And
is
where
absorbed.
would one get zinc sulfate? Do I just crush up a tablet and drop it in water?
Yes, yes, yes. You can just
Okay,
crush up a tablet of pure zinc sulfate,
got it.
put 1% in water, and put it on the tip of your tongue. If you
Cool.
can taste it, okay, that means your zinc is normal. Your body is not absorbing that zinc in, and it's normal. But if you can't taste it, then your zinc is low.
Got it. Got it.
So that's how you
Um,
can do this. Now, another thing is that zinc is absorbed by using vitamin B6 in the body. If your
mm,
B6 levels are low, no matter how much of zinc you take in, it's not getting absorbed at all.
mm,
So that's why calculating how much of zinc to give to a person is weird, because
impossible.
you need to know what their B6 level is,
Right.
what the B6 is when you give zinc.
Got
What we
it.
usually do is we give zinc about 20 mg if the patient has failed the zinc tasting test. And along with that, we give them P5P, which is pyroxyl 5-phosphate, the active form of B6. And we give about
Nice.
50 mg once a day.
Cool.
Okay.
Thank
And we
you.
are
That's
constantly
really
checking
helpful.
that tongue. We're constantly looking if they have a fungal infection. If
Mhm.
they do develop a fungal, we need to stop that zinc in right away.
Yeah. Yeah. I'm very aware of this white tongue. Whenever I have a bit too much carbs,
Yeah.
being a health coach, right? Notice the white tongue. The other thing I've noticed is that there are, I know this is probably going to another group of symptoms, but is it possible that we have these viruses, these herpes, these old viruses hiding in our body,
Yes.
and could that bring up the fatigue when after COVID?
Yes. So I was getting to that as well, that you can have chronic viral reactivation. But before that, there's one more thing that I would like to say about
Okay.
chronic fatigue. So we've spoken about cortisol, we've spoken about fungal infections. The next thing is about oxidative stress. So during any viral infection, you're going to have a neutrophil rise. You're going to have a little bit of a cytokine storm happening. Your neutrophil count is going to go up, and those neutrophils are going to increase oxidative stress. The enzyme that does this is actually an enzyme called as NOX2 or NADPH oxidase. That's basically it's allowing your neutrophils to make oxidative stress to burn toxins out from your body. But oxidative stress doesn't do such a good job in viruses. It does a great job in bacterial infection, but for viruses, not much. Even after you have recovered from COVID, sometimes there is increased neutrophilic activity and NOX2 increases. Why this happens is because your lymphocyte counts after COVID usually drop because your NK cell numbers drop, your CD8 T cell numbers drop. So the entire job of fighting infections goes on to the neutrophils. And these neutrophils upregulate NOX2 and patients get a lot of fatigue because of it. They have oxidative stress. If you want to measure oxidative stress, what you can do is you can look at urine tests. For example, what we do is we measure a urine metabolite called as 8-isoprostane. If the levels are high, that means you have oxidative stress. Via blood, you can measure a level called as T bars. You can actually measure your catalase levels and all these other markers. If as a symptom you want to look at it, is oxidative stress causing me problems? If you eat carbs, you're eating carbs after COVID and you feel worse after them, that's most likely due to oxidative stress. Because when you're burning carbohydrates, you're actually creating oxidative stress. You're creating a lot of carbon dioxide that is forming.
I see.
And that oxidative stress after carbohydrates increases. If you're feeling worse after carbs, you're definitely having oxidative stress. Oxidative stress will also make your cells more resistant to insulin, so you'll start having brain fog. So you get brain fog along with fatigue. Now for these things, we have a medication that we've made called as imusil. It's a patented drug. It's now sold all over India. We're exporting it to many other countries. It's a very simple drug. It's a combination of 3 herbs. One of the herbs is called as kutki. It's called as picorizа, and it's a specific NOX2 blocker. We have a published paper on it as well. It's being published in the Journal of Pharmacology. And it shows exactly how this herb works on NOX2. It inhibits it. So our patients take about 2 pills a day of it, and within 3 to 4 days, they start feeling their fatigue go down. We've also had this pill tested by a government laboratory for its action on COVID, and we found that it has an efficacy of 71%. So within 48 hours, it kills off 71% of the virus. So we've also used this in patients with COVID, and we found that if the pill is started early on, the patients recover very rapidly from COVID, much faster than with any other drug that's currently there on the market.
Fantastic.
And for long COVID, it just works wonderfully well. Because along with the low cortisol, you could also be having oxidative stress. Because in every single case of COVID, your neutrophils will increase NOX2 and you will develop fatigue because of oxidative stress. So that's like an overlapping thing. So that's the third cause of fatigue. The fourth cause that you were talking about is viral infections. So chronic viral infections like Epstein-Barr, chronic viral infections like CMV, HSV1, HSV2, we've seen these things flare up after COVID. We've seen patients having penile ulcers after COVID. This is because of reactivation of HSV2. So we can have HSV2 checked, we can have the IgG, IgM checked for it. We've seen patients reactivating HSV1 where they start having mouth sores after COVID, frequent recurrent mouth sores. This is again HSV1. These patients are usually given drugs like acyclovir, valacyclovir to treat the herpes, but these drugs are just immunosuppressive. In most parts, they don't actually eliminate the virus out. So you continuously have fatigue because the virus is lingering on in your system. For this, we have certain homeopathics which work. So I'll just explain this to you. If your IgM is elevated, it means you're having acute infection. So if your IgM to HSV2 is expressed, or IgM to HSV1 is expressed, or your IgM to Epstein-Barr or CMV is expressed, the homeopathic that you require is carcinosin.
Mm.
If you're having mouth sores, okay, and your IgM is not highly expressed, only your IgG is going up, then you require two homeopathics, again, Natmor, which we've spoken about before, and another homeopathic called arsenic album. That does the trick. If you're having penile ulcers and you're having fatigue with penile ulcers and anxiety, and your IgM is normal, so now you don't have to use carcinosin, then there are other homeopathics which you use. So you take the first two, Natmor, arsenic album. You add a third one called as ammonium muriaticum, which is basically NH4Cl. So ammonium, NH4, and mur means chloride. Ammonium muriaticum, which will treat that burning pain that you have because of the penile ulcers. And the last one is another homeopathic called as jacaranda, Jacaranda, jacaranda. This one is very specific for HSV2. You combine all of these in, say, a potency of 200C, and you take about 4 to 10 pills 3 times a day. Within a week, those ulcers will completely heal off. And when you have your IgG again checked, you'll find that your IgG is becoming normal. You need to continue them until your IgG has completely become normal. So this is how you can treat them. If you are having Epstein-Barr flare-up along with fatigue, one of the interesting symptoms of Epstein-Barr is you get severe gastritis. Patients have severe gastritis. We've seen this even in patients who have taken the vaccine who have gastritis as a symptom. The stomach starts to burn. Okay, they're not able to eat. They feel they have acidity. They go in for their cardiac testing because they feel they're having a heart attack. It's not a heart attack, it's just acidity. Epstein-Barr can cause this severe gastritis because it affects the epithelial cells of your colon and even your stomach, and can cause you this acidity. So if your EBV IgG is elevated, then there is a certain other line of treatment. We have a low dose form of EBV med, which we manufacture. And when patients take it, their gastritis clears off. Okay. So this is the other part of fatigue. Again, for the gastritis, you can take my EBV med along with a homeopathic, which is called as acid muriaticum. Muriatic acid is basically hydrochloric acid. So when the same hydrochloric acid is taken in the homeopathic form, it treats this chronic acidity with fatigue. If you just have acidity without fatigue, the acid more won't work for you, because when one of the symptoms of low stomach acid is chronic fatigue. Okay, so when you have this particular symptom, take muriatic acid. Again, the symptom is you have acidity with chronic fatigue, not without. Okay, if you have it without fatigue, there are other lines of treatments which you can take, which I can explain. Right. But with fatigue, if you're following me, take muriatic acid with my EBV med. If you have CMV as an infection, which is flaring up, what you will notice is your IgG to CMV will be high. After 1 week, when you retest it, it will be even higher than what it was before. So when you see an increase of about 10% in your IgG values between what you've taken now and what you've taken after a week, that means the infection is active, even if your IgM is normal. If you see this, the symptom that you will usually get is severe bloating and gas in your stomach. You'll have severe nausea, vomiting sensations, and a lot of gas in your stomach. Gas is one of the weird things that CMV causes. So again, for this, we have two of our meds. One is called as emetine. It's a low dose emetine that we make. It's a medication that targets CMV. And also we have a low dose medicine made from CMV, which is called as CMV. So when patients take both of this together, the fatigue and the gas and the bloating, all of it disappear. So this is the reactivation of chronic viruses which can cause fatigue and COVID.
Nice, nice. And I always remember you teaching is EBV is the B cells and CMV is the T cells that are being affected. So
Yes.
we are really screwed when we get a reactivation of CMV.
Absolutely.
So yeah, I wow, that's such a so clear and concise and remedy with the symptom. I'm sure a lot of you are like, okay, where do I get these things, right? So of course for homeopathics, you can probably find a local homeopathic shop. and the potency. Can you mention again the potency that we can get most medications in?
The easiest potency to use is about 200 C, and what I would
Okay.
recommend is you take about 4 pills of it first, and wait for about 3-4 hours, see how you feel. If you start feeling better with the first dose, then you can even repeat it 2-3 times a day until your problem is cured. If you
Got it.
feel that after the first dose has not helped you, try another one after 3-4 hours. If that's not helped you, try another one after 3-4 hours. If 3 doses of the medicine have not helped you, that means it's not going to help you and your pathway is incorrect. Please get in touch with us and we can actually help you find out what's wrong with you.
Cool.
I'm still not actually done with fatigue.
Oh, not
One
yet.
other reason why you could be having fatigue is you could be having clots. So patients after
Oh,
COVID have
yeah.
elevations in D dimer. The D dimer elevations can cause severe fatigue. CRP elevations can cause severe fatigue. So I'll talk about a case of mine. I had a patient call me 3 days ago saying, please help me. My joints are paining. I'm so fatigued. I've had COVID almost 3 months ago and I'm still suffering from these symptoms. So I tried to take history from her. I couldn't get anything from her except that her joints were paining and she was having severe fatigue. So I asked her, have you done any blood tests? She said, yes, I did a blood test. I found that my CRP was high. I found my D dimer to be slightly elevated. So what I did for her is I gave her a homeopathic combination of two homeopathics. One is arnica, which decreases CRP after COVID, and the second one is sulfur, which decreases the D dimer levels. So you give arnica plus sulfur, you give her 200 C4 drops. Literally after 10 minutes, she calls me back saying, my pain is so much better. Can I take this again? I said, yeah, you can take it as many times in a day as you want until your joint pains are gone. Today morning, she called me up, which is just about 2 days, and says, all my pain is gone. After 3 months of suffering from severe pain, in just 2 days, all my pain is gone. She is the daughter of a doctor herself, and her father was trying everything possible to treat her D-dimer. He was giving her, of course, aspirin. He was giving her Clexane, which is a drug that decreases blood coagulation, but it was not happening. The reason why these drugs don't work for D-dimer and why they usually fail is because the D-dimer is caused by inflammation by a specific receptor called toll-like receptor 2, and sulfur helps to down-regulate toll-like receptor 2 just enough for the inflammation caused by IL-1, TNF, IL-6 to subside. As it subsides, the D-dimer automatically comes down to normal. Arnica is a very specific homeopathic which upregulates a cytokine called as interleukin 10. So it increases IL-10, decreases inflammation, and decreases your CRP levels. That's why the combination of CRP and sulfur works so well for this. So this is the last cause of fatigue I've seen. And if you have any of these features and you have any of these weird lab parameters, make sure that you take these remedies and you'll see the benefits coming from it.
Fantastic. Yeah, arnica and sulfur like a magic drug. So
You must have seen this,
yes,
working
I've
with your
seen
other
this. Yeah,
cases. Yeah,
yeah, I've seen these cases a lot.
instant.
Yeah. So thank you, Dr. Eric, for your precious knowledge. And I know this is a bit long, but this is a very important piece. So hope you'll find some solutions for your problems. And until next time, tune in for the next. Do you know what are we going to talk about next time, Doctor?
Yes, so in the next one, we're going to talk about other symptoms of long COVID. We've just covered fatigued. Now we got to cover things like headaches. We got to talk about palpitations. We're going to talk about anxiety disorders, insomnia, gastritis, which I've kind of hinted at, chronic diarrhea, stomach pains. What else is there? Exercise intolerance, which happens in a lot of cases, flare-ups of viral infections, which we kind of hinted at when we spoken about this, severe brain fog that happens in patients. They can't even remember at times where they are at. So all these things I'm going to talk about it. Blurred vision, herpes attacks in the form of Bell's palsy. The patient comes with ophthalmoplegia, which is blurred vision. We had a case in our group of a doctor seeing a patient who came with blurred vision after COVID. He was having ophthalmoplegia. Okay. And then I said,
all kinds of stuff is
all
coming.
kinds of symptoms.
Yeah.
We checked his D-dimer, we found his D-dimer was normal, but when we checked his prothrombin time, that was elevated and his fibrinogen was low. So then we gave him a specific medicine for that, and the ophthalmoplegia cleared, his blurred vision cleared up. So
Yeah.
it's quite a interesting bunch of symptoms that patients have, and I
Yeah.
hope that
Yeah.
during this video series, I'm able to
Yeah.
go through all these symptoms.
And if you have a symptom that you want us to discuss, you just pop a comment down below, and we can see if we can make that a priority. So
Yeah,
cool.
sure, sure.
Yeah.
If you
That's
want imusil, you need to take imusil for your oxidative stress, you can just write an email to me. We'll find the local supplier for you whom you can contact and from whom you can get it.
fantastic. Okay. Cool.
Okay,
That's the
Dr.
end of
Craig.
this video.
Thank you. Bye.
Bye.